Why is COVID overtaking the flu? Isn't this flu season?
Well, it is typically flu season, but the deal is the scientific community is revealing that COVID, especially these more recent strains, are more infectious than the flu for most people. And a lot of this is due to the fact that over the last few years, we've been using those mitigative measures like wearing masks more, social distancing. But now, everybody's out and about. You go anywhere, large sporting events or just gatherings of people, even religious gatherings, people are just congregated together. They're not wearing the mask. It's getting cold. We're indoors without that ventilation, which makes a lot of people vulnerable to infection with COVID. And that's what's happening. We're getting a lot of people coming in with COVID. And the good news is we now have effective treatment, but we still need to be aware of what's going on.
Let me ask you about that treatment of the patients that you're seeing who are coming in with COVID. Have they been vaccinated?
I'd say the majority of patients have had some of their vaccinations. I'm a little bit, and including the scientific community, we're all a little bit discouraged or disappointed that a lot of people aren't getting those boosters, because these latest boosters is so important. They're modified specifically for those most prevalent infectious strains that are out right now. So if you've been vaccinated, you have some protection, but it's such a good idea to get those latest boosters because they've been modified specific for these new strains that are very infectious. And it's really advised for everyone to get the latest booster.
Do we need to get the COVID vaccine every year, just like we get the flu shot? What's your take on that?
It looks like it's going to be that way. And that's what's being discussed in the scientific community. And what's so good about it is the fact that, like the flu vaccine, every year the flu vaccine is modified. And it's modified to have a higher probability of being effective with the latest strains of the flu. Well, they're able to use the same science with the COVID vaccines and boosters, where they can modify it every year so that when you get that booster, it's more likely to be effective against the most prevalent strain to give you the best protection.
Real quickly, Dr. Quinn, we've got flu season going on. We've got COVID out at the same time. Are you seeing very many people that are having both diseases at the same time?
Not a whole lot, but we have had a couple. And that's something to really be concerned about, because if you contract COVID and the flu at the same time, your immune system is trying to fight both. And it could result in someone getting very sick, resulting in pneumonia. And especially if it's someone vulnerable, elderly, or someone with chronic medical conditions, they could lose their life. So it's something that we really need to be on the lookout for.
Yeah.
All right. Good advice for us. Thank you so much, Dr. Quinn, for being with us, as always.
Thank you.